That's as far as can we go further, or is it limited by hamstring tightness?
Limited by, so I feel like a tugging right behind my knee.
Okay, so he can go a lot further going backwards than he can going forwards, like a reduced curve, which to me might suggest potential posterior pelvic tilt, which would mean tight hamstrings, elongated quad. Also lead to feeling stiffness within the back too. Closer, please. You hold the elbow, good. Breath in, all the way out, and just relax as I roll you towards me. And all the way out, good. There was one big clunk. Breath in, and all the way out. Good, let me roll you. Nice, perfect. Caleb, good to officially kind of re-meet you.
Yeah, absolutely.
So Caleb is a personal trainer, and he's in today kind of for a checkup. He was interested in being in a video, and has got his own kind of lower back issue going on. So I'm going to let him talk about it. Caleb, why don't you share with us what's going on?
Yeah, so I would say for as long as I can remember, I've had tight hamstrings. So things like deadlifting has been very difficult. I got a trainer at Good Life. And I've gotten a lot of extra mobility out of that, but it's still obviously they're very tight, which kind of leads to when you're bending to pick stuff up and you're hinging, you get some lumbar bending there, which I mean, I've hurt my back on deadlifts before.
Lovely, yeah, so have I.
Yeah, and even bracing properly is something that's important, but that still can't really make up for just proper mobility. Yeah,
okay, so your issue really is kind of, well, part of it is mobility, and it seems like you've already started to address that with your own personal trainer, which is really, really good, because they're going to be able to provide the physical approach to things, right?
Yeah.
Now, one of the downsides, like Caleb is very tall, you haven't seen him stand yet, but he's got long femurs, and when you do have those longer femurs, when you do try to go into your hip hinge, it's more challenging because you need to lean forward with your back naturally, just by the nature of your anatomy. Fortunately, I'm shorter, so I'm able to stay more forward, but that's the opposite in this case. So you're going to be fighting that mobility battle pretty regularly.
Yeah.
But it does unfortunately predispose you to. It makes it harder for you to engage your core during that, right? Because as you become more and more compressed in that region, it's harder to engage. So you are fighting a bit of an uphill battle there, but it's good that you've started making progress against that because you are taking the necessary steps to get it addressed, right? Now, you've had hamstring tightness for as long as you remember. If you had to put like a number on it, how many years have you been dealing with that for?
Now, I've only been working out probably since 2019-ish.
Okay. Yeah.
And that's when I noticed, because like when I go to deadlift or something, it's like I'm fully arched, and it's obviously gotten better. And my trainer and I use trap bar deadlift a lot, which is again easier. Lots of RDLs, so we don't necessarily have to tap the bottom. But I kind of noticed pretty quickly that I can't deadlift conventionally very well, and I avoided it for the longest time, and I was that guy who didn't stretch for when I started.
I still am that guy, and I tell people to stretch, so don't feel bad about
it. My trainer, Jake and I always have a battle over like how much I'm stretching. And
not enough is kind of probably Okay.
I did see kind of a physio at one point, and he said that my core is weak, so a lot of the issues going to the hip flexors, which in turn is making the hamstrings tight. I can see how that might be a factor, but I do a lot of just hamstring mobility, but I do a lot of core work as well.
So, I mean, I hate telling patients that they got a weak something, especially when those people are the ones who are moving heavy weight quite regularly. Like, I treat various bodybuilders, and I would never tell any of them that they have a weak core because they don't, okay? That being said, you might have a little bit of trouble engaging it in the necessary way. Maybe your biomechanics aren't conducive to having an engaged core when you are that compressed or hip hinged. But something about that language I'm not really a huge fan of. That I don't want to imply that you are weak in your core. You probably got a strong core. If I were to punch you, you could flex. I'm sure things would be fine, okay? But it could just be that difficulty engaging it properly or with whatever movement patterns that you're actually dealing with, not weakness in itself. Now, you mentioned hip flexors too. What's going on there?
Yeah, it's just I think they're pretty tight. I said hip flexors based on what the old chiro had, or the chiro slash
physio person, someone you saw.
had said, I do feel like, reverse squats, there is popping. That's obviously why we do reverse squats, is to loosen that up a little bit. But yeah, there's popping, clicking when I do that. I can feel they're pretty tight sometimes.
Okay. All right. So we'll do our best to treat both of those things. It's interesting to hear that you're experiencing tightness on both your hamstrings and your hip flexors, because those are two antagonistic muscles, right? They do opposite directions. So how is it possible to be tight on both sides?
I think that it's just, I think my posterior chain mostly is just tight. And I also I do have tight adductors as well. That's something that I've been dealing with for a little while. So it could be maybe just weakness in the hip flexors. I'm not exactly sure how to address that.
Yeah.
But
so there's when you put your hands on a person, okay, it's easy to detect when a muscle is hypertonic. Okay, that's the medical term for tight. All right, but the problem is that one can feel hypertonicity for two different mechanisms, which are ironically the complete opposites of each other. Okay, like let's pretend that somebody is really, really flexing really hard. You got a really, really engaged muscle. Okay, you put your hands on that, that's going to feel tight, right? Like that's the word we use. That feels really tight. Doesn't want to relax. Okay. Now let's do the opposite direction. If you were to take a muscle and stretch it as far as it will go, and then you will run your hands over it, well, that feels like a guitar string almost, and we will describe that as tight. Okay. However, they're two opposite things. One muscle is shortened, one is lengthened. Okay, in kind of like a broad sense. That's not really the way it works, but in a broader sense. So it's possible that we're experiencing tightness on both sides, but one muscle might be overly engaged, one muscle might be overly slacked or overly taut, pulled further. I don't know yet. We haven't examined yet. Okay, but that's kind of where my head goes anytime I hear somebody say that they have tightness on both sides of their legs, because that's the only way that it makes sense to me and the function of the pelvis. Does that kind of make sense to you? Have you ever been kind of explained that before? Or
that makes sense.
So have you heard that before, or that kind of thought?
Not really.
No. Okay.
No.
All right. Well, at least that's something new. Okay, because I don't want to bring it in here and just kind of say the same stuff that you've heard before. I want to try to show you a newer perspective that hopefully could be correct. There's no wood to knock on. There we go. We'll knock on that wood there. So, what we're going to do today is we will do that physical examination. We'll figure out, at least in my eyes, what's going on, and then we'll get into treatment. Okay, sound good? Perfect.
Sound good.
See, so Caleb is so tall that it's actually really hard to get him in frame, but that kind of speaks to one of the issues we're dealing with here. I'm going to get you to bend down, touch your toes for me, if at all possible, okay?
Knees locked, or?
Yeah, keep your knees as straight as you can. Now, that's as far as can we go further, or is it limited by hamstring tightness?
So I feel like a tugging right behind my knee there.
Okay, so if he feels that tugging behind his knee, that is where the hamstring inserts onto, which tells us, yeah, we do have tightness of a sort in the hamstrings. Is it due to it being contracted? Is it due to it being overstretched? We don't know yet. I'll get you to now lean backwards, the other way instead. Okay? Okay, so he can go a lot further going backwards than he can going forwards. Like, that's a significant discrepancy between the two. Last thing I'll take a look for, I want you to pull the shirt forward as far as you can so that I can take a look at your curve here. Okay?
Well, I've always been practicing my matrix moves, so it's I got my lumbar.
He's ready to take on Neo, right? Or I know it's Agent Smith. That's it. Yeah, the bad. No, Caleb's a good guy. Okay. So here, Caleb doesn't have the biggest lumbar lordosis, which means that curve in the low back, and that's not necessarily a bad thing. Okay, people who do have a greater lumbar curve typically are dealing with something known as an anterior pelvic tilt, where their pelvis is tilted forward, and that results in tight quads and elongated hamstrings. Okay, we actually see a little bit of a reduced curve, which to me might suggest potential posterior pelvic tilt, which would mean tight hamstrings, elongated quads. So that could be what's going on right now, why he's experiencing tightness on both sides. And in that sense, it would also lead to feeling stiffness within the back too. So that's where my hypothesis is, just based off a quick postural analysis as well as the range of motion. And that's probably what we're going to be dealing with going forward. But let's do some other tests.
I do get the butt wink, so that's going to be...
You get the butt wink, too?
I get the butt wink, yeah.
Okay.
So it's definitely posterior pelvic tilt.
Now the butt wink is what occurs when you go too low in your squat and your butt visibly tucks underneath yourself. That's not something you want to see in a squat, but that would indicate, again, that over contraction of the hamstrings, or just you kind of let go of your posture at that point. So it's all fitting together a little bit in my eyes. I hope it is to you too. Yeah. Again, anytime we're treating any area of the body, it's good form to do a neurological exam for both the upper or the lower. So let's start with the lower here. And we got low reflexes, but that's equal bilaterally. So that's not of a big concern to me. I would be concerned if one was large and one was really small, but if that's just as normal, it's as normal. This is my first time seeing them in clinic. So relax the foot as best you can. That one was good. That one was good. Good. Push this leg up into me as hard as you can. Push this leg up into me as hard as you can. Lift the toe up as hard as you can. And lift the toe up as hard as you can. Symmetrical and normal neuro. So we're going to start with the gold standard of tests, or every chiro physio's favorite test, which is the straight leg raise. So I'm going to go ahead. We're just going to start on the left side. Or do you experience tightness on one side more than the other, or is it pretty symmetrical?
I would say my left side's a little
left side's a little tighter?
Yeah,
okay.
When I'm doing single leg RDLs, I can get lower on my right and left.
All right, so let's start with the right side then. I always like to start with the quote-unquote better side than the worst one, just so I have a better idea of normal. Let's bring this up as straight as we can, as high as we can, and that's literally as far as we go before his pelvis starts to lift off the table. So we're getting to about 30 degrees here,
yeah.
About maybe just that. The normal range of motion for a straight leg raise is between 80 and 90. So definitely what I would consider a positive test in this sense, even though the straight leg raise actually tests for our radiculopathy, which is a separate thing. But yeah, that is a low straight leg raise, which also would indicate the hamstring tightness. There's that word again, right? I'm going to bring this up as far as we'll go. And that's about the same. And again, the pelvis starts to lift up off the table, so we're not going any further. And we'll lower that back down. Now, what I will do next is I will bend the knee. I'm going to place my hand behind your back, long femurs, and very long femurs, and any discomfort in there.
Not really.
No? Good. Okay. Bring this up, and any discomfort in there.
No.
No? Okay, yeah. So no low back discomfort provoked on the SI tests. Let's do kind of a hip screening here. I'm going to bring this up as high as it'll go. Any discomfort in through that motion, excuse me. Okay. Now one thing I do want you to also test is I want you to actually slide yourself as far down as you'll go. Okay, like so that your legs are essentially off the table. This? Yep, perfect. Now I want you to pull you said it's the left side that's worse. So I want you to pull your left leg actually into your chest with your arms. Okay, as far as we'll go. Yeah, wrap your hand around the knees, around the knee. Okay. Yeah, so we are getting a pulling of his tibia down lower around the knee area. So what that tells us is that we do have a hypertonic. Once again, another tight quadriceps too. Let's do it with the other side, please. And same deal, we get that lifting of the tibia, another hypertonic on both sides. So what he's saying is definitely true. He's not lying, not that I thought he was going to lie. But it's good to check these things all the same. I'll get you to go face down. On the table here, I'm going to come in and feel through that low back, see if there are any kind of issues stemming perhaps as a result of that posterior pelvic tilt that we're seeing. It's also good form, once again, to check both above and below the chain. Now, granted, we're already dealing with the lowest chain that there is, so I am going to check a little bit into the lower aspects of his upper back. So let's get started with the SIs. Left side, he says, is worse than the right.
Just slightly. I don't
just
notice,
a little bit.
I don't notice it in regular life.
Good.
But when I'm doing like RDLs, single leg.
Well, I was going to mention actually, your SIs feel pretty symmetrical too, with maybe a teeny bit less bounce on the left side, but like it's so minor that I'm not too concerned about it. We'll adjust it today, no problem. But I think that the biggest solution for you thus far is going to be the quote unquote loosening of the hamstring and the quote unquote tightening of the quad, which is actually kind of rare because most people have hypertonic or really contracted quads. But that's usually in the more, no disrespect, out of shape population, the people who don't really keep up with their physical levels of fitness. The quads become more dominant because the posterior chain is not very often engaged. If you've been focusing on your posterior chain lately, you could get the opposite problem, right?
Yeah.
So that is to say that Caleb works out a lot. Good job, man.
Thank you.
You're welcome. Well, you did it. You earned it. Yeah. You've earned this condition. That's totally backwards. Anyways. I got this backwards now. Okay, now there we go. Freebie.
Oh, yeah.
All right, so we already got an incidental release when we were just palpating through the region. I'm going to turn the camera just a bit. But we're going to go ahead and actually do an intentional adjustment in through the lower thoracics here. So Caleb, I'll get you to take a breath in for me, please. And then all the way out, and sink into the table. There was a little one there. Good. Sometimes you need the old 1-2. It's interesting that your low back actually doesn't feel that tight to me, coming from somebody who's felt a lot of tight low backs, but maybe a little bit on the right there. But okay, I will get you to lay next on your side facing the window. You're in the right-ish position. I'll get you to scoot your hips a little closer, please. Good, and then relax right there. Nice. Okay, you hold the elbow. Good, and yeah, I'm out of the way. And breath in, all the way out, and just relax as I roll you towards me. And all the way out, good. There was one big clunk. We will get you on the other side. So we'll bring this up. I'm going to take this, pull, good. And you can hold right there. Nice. So once again, breath in. And all the way out. Good, let me roll you. Nice, perfect. So as we were getting Caleb ready for the scraping component of the treatment, I realized that he was wearing Marvel Thor socks, which, if you guys don't know this about me already, I'm a huge Marvel nerd, like a massive Marvel nerd, even though they started to go downhill, at least in their cinematic universe. But then Caleb started telling me about how he grew up with like traditional comics. So Caleb, why don't you tell us a little bit about that?
Yeah, so my dad had a huge comic collection. I think I started collecting around, I got some early, late 70s, early 80s, Peter Parker Spectacular Spider-Man comics. Mm-hmm. But he mainly started collecting around, I think, when Todd McFarlane started illustrating Spider-Man back in the 80s.
This is fantastic.
So he was the guy who created Venom. So I actually have like the first appearance of Venom. It's not in very good shape, so it's probably not worth it.
It's well read. Eh?
It's well read. But something a lot of people don't know is, and that's Amazing Spider-Man 300. So, but in 299, actually, it's an issue where Spider-Man's, I think he's teaming up with Chance, which is a mercenary guy, who has a jetpack and whatnot. And there's a side story going on, and at the very last panel, Venom shows up at Peter's apartment when Mary Jane gets home. So the last panel is Mary Jane showing up and looking at him, and it's just a completely black panel, and all you see are the whites of his eyes and the spider.
That's terrifying.
And the mouth.
Mm-hmm.
So that was in 299. So I have both 299 and 300.
The original appearances of one of his greatest villains.
Yeah, so I got probably most of Todd McFarlane's run original issue.
What's your take on the current Sony MCU disasters between keeping Venom out of the actual MCU?
Oh, it's awful.
It's a tragedy,
it's terrible.
right? It's terrible. So,
terrible.
Sony, if you do watch these chiropractic treatment videos, get your shit together, all right? Figure it out, because you're frigging it up.
Yeah. No, it's awful. Madam Web's coming out.
I saw that. Is that Sony again? It is, isn't it? Yeah, that wouldn't be MCU. Sony's got their rights like down hard.
So they're putting 3 Spider Women in there.
Oh my goodness.
And it's not anything that I think it's has any chance of being good.
That's unfortunate. So Sony's track record isn't the greatest with anything that isn't animated, at least.
Yeah. Craven's coming out.
I don't understand why Craven needs his own movie.
No, and he's an animal lover now, so he's not actually a hunter.
Hunter, okay. Thanks, PETA. Oh, wait, I just got canceled. Okay, whoops.
And then I think Venom 3 is supposed to be coming out this year, too.
I mean, I'll watch the Venom movies just because they are, at a baseline, entertaining. Like, I enjoy... Crap, I can't remember his name right now.
Tom Hardy?
I enjoy Tom Hardy, and I enjoy, like, the way he's portraying him, but I just wish that it was incorporated into the overall story, right? Yeah.
Well, it's honestly, like, I watched Spider-Man 3 not that long ago, and it's better than Topher Grace.
Better than, pardon?
Topher Grace is Venom.
Topher Grace, that's the one who made the director?
No, the actor in Spider-Man 3.
Oh, you mean like the original like Tobey Maguire, Rami? Yeah, okay. All right, I think my Spider-Man 3, I was like, you just saw Far From Home?
No,
like, what is wrong with you? Yeah, okay.
No.
No, you mean the original? Yeah, gotcha.
Yeah.
I actually completely forgot about that, but no, Venom was in that too, or at least that was Sam Raimi. Raimi? I don't know if I'm saying it right. Raimi, yeah, better than his portrayal, in my opinion.
Yeah. I recently got a Lego set from No Way Home.
Oh my god, you do Lego too.
And it's huge.
We could be friends. Like, this is hilarious.
And it's the set of the final battle.
Really? Like, on the clock tower?
Statue of Liberty.
Yeah, not clock tower, Statue of Liberty, yes.
Yeah, and it's got all 3 Spider-Men.
Oh my god.
And the original set had Doc Ock, Electro, and Green Goblin. Mm-hmm. But they released an expansion.
For Sandman and...
with Sandman and Lizard.
Good.
And
you can't
I got
them.
the expansion, so it's a whole, like... It's got all the villains, all the Spider-Man.
Oh my goodness.
They have different places to put them, so it's a really nice display piece. Great.
So yeah, we got a passionate Marvel nerd here, and it's actually nice to have him on the channel because so am I, but I never get to talk about this kind of stuff. So thank you for being here today.
I'm all comics, Marvel and DC.
Oh my gosh, really?
Oh,
okay, what's the tragedy with the DCU? Terrible.
I can't even get started.
Yeah, let's not.
I can't stand Zack Snyder. I know he's got a lot of fans. Mm-hmm. He basically ruined everything.
What did you think of the 4-hour supercut?
It wasn't even that good.
I actually enjoyed it way more just because I didn't know anything about any of the other heroes, right?
Fine, but it's like, I don't know.
Alright, well. Anyways, I guess I might as well actually tell the people what I'm doing here. So, like we mentioned beforehand with the posterior pelvic tilt, it suggests tightening, yes, that word, or rather contraction, over contraction of the posterior chain in this case. So it is prudent to hit those muscles with some massage, something to release them and relax them, while he focuses on strengthening the anterior chain through things like leg extensions or leg press, loading up the quadriceps. He also mentioned that he actually has some issues in firing off his lumbar erectors, which is your low back paraspinals, that is in line with the posterior pelvic tilting of the pelvis, because they would be consistently overstretched in the event of a contracted hamstrings too. So the diagnosis fits pretty well. I think we're going to be able to help him out pretty well if he follows kind of the rehab plan there, as well as the manual therapy components. Overall, feeling pretty confident about this. So, yeah. Actually, yeah. So it's good form to always do something called test-retest anytime you are applying treatment to a patient. And this is going to be a really good example as to why. But it's essentially to see if what your treatment did, if the intended treatment did what you wanted it to do, right? How are you going to know that if you don't retest to check back where you were before? So what I would do here is I would redo the straight leg raise test in this case. So I just redid it, and we only had about maybe 5 degrees of improvement, which isn't exactly what I was hoping for. So we're going to add an additional treatment onto that, which I've done on this channel before. If you want to watch that 12 years of knee pain resolved video, or whatever it was called, for the guy who's getting knee pain due to tight hamstrings. But we're going to do that here. So what that's going to look like is I'm going to bring this leg up. So not much improvement over beforehand. But I'm going to get under, you guys can't even see me on camera, but I'm going to get under this leg, and I'm going to get you to try to drive your foot down into me as hard as you can for 10 seconds, okay? You can hold onto the table if you need to. Just be mindful of the microphone right there. Good. Yep. All right, so 3, 2, 1. Relax. Relax that leg for me now. And what we'll find is that after that contraction, we are then able to stretch further. Now that probably feels a little bit painful there, right? Yeah, just a teeny bit. All right, let's go ahead and let's drive again. 10 seconds as hard as you can, okay? 10, 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax, relax. And once again, on that relaxation mechanism, we can now get a little bit higher. So we've broken 45 degrees at this point, which still isn't into that 80-90 range that we ultimately want, but you do seem to respond well to this form of stretching. I'll get you to drive once again, 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax. Relax. Okay, good. So that's as far as we're going to go today, because I can see his face, and so can you guys. It doesn't, actually from this angle, yeah, that's kind of funny with the hand. That's a painful looking face. So we're going to camp out right here, but we did manage to get him from what was previously 30 degrees to what's about 50. So I'm happy with that. Let's do that on the other side. Bad news, you have 2 legs. So all right, I'm going to get my shoulder under there. Good. And once again, drive as hard as you can, 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax. Good. And once again, drive. 10, 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax. This side is a little bit harder. I can see your pelvis is tilting a little bit with this. Last one, okay? You're tough, you're strong. 10, 9, 8, 7, 6, 5, 4, 3, and 2, and 1. Relax, relax, relax. And that's as far as we're going. All right? So good news is that we are able to increase that range of motion available to his hamstring. It's going to require some work. That is for certain. Yeah. All right, we will slowly lower down. There we are. Caleb, how did you find all of that?
I really liked it. It was, I found the scraping to be not so that fun.
Yeah, probably not.
But I could feel it was helpful. Mm-hmm. The very last thing was again,
that PNF stretching that we just did. Yeah, mm-hmm.
Was kind of awful, but great. When I got up, I felt looser, mm-hmm. For sure.
No, what you're saying is very common.
Yeah. Mm-hmm. Yeah, but I generally like that. A lot of chiropractors, you kind of you come in, you get mm-hmm. a quick adjustment, mm-hmm. and they work on your back, mm-hmm. and they're like, I'm a back doctor, so I'm just going to crack your back a few times. And get you out of here in time for lunch. So
and then some, yeah. Mm-hmm.
And I liked how there was a bit more of a more comprehensive method mm-hmm. taken here.
All right, well, thank you. Yeah, so what he said rings true. Chiropractic has come a long way in terms of its kind of scope of practice. We've always had this musculoskeletal domain to us, but traditionalists were taught that things really do all stem from the back, which in a sense they kind of do, but they also kind of don't, right? So in this case, we're dealing with a lower limb issue. We really focused in on the lower limb and addressed it as best we could. And yeah, I always preach this kind of diversified approach where you do more than just adjust your patient. You examine that posture, you see what they can change on their own, and take a multifaceted massage, osteo, all those different things, which is why I call myself a diversified practitioner, right? what you're saying isn't uncommon about feeling pretty beat up or pretty sore during these treatments. Some people say the tools feel phenomenal. Other people say the tools like actually hurt quite a bit. I actually joke with my patients, well, not really joke, but like in the informed consent process, I tell them, hey, you're probably going to be sore after this. I give like a 1 in 3 chance, because that's quite common, but sometimes things got to hurt before they get better, right? I found I became a much more effective practitioner when I stopped, quote unquote, caring about hurting my patient. Of course, I don't want to hurt you. I'm never going to intentionally hurt you, but the process of the treatments, yeah, I'm a little bit more liberal with the pressure. BNF stretching, same deal, hurts like crazy if you have really tight hamstrings, but ironically, that also means you need to do them, right? So, do you have any other questions for me? Any other comments, concerns?
No, I don't believe so.
No? Okay, well, if you do, you're free to email or text me or message me on Instagram. I think that, that's how we were talking over Instagram, right? Thanks for coming in today. Okay, I feel good about the diagnosis. I'm confident we can figure this out for you. All right?
Awesome.
Thank you.
Thank you.
You have a good one.
Don't forget to like, comment, and subscribe.
Thank you, Caleb.